Good afternoon, Victoria County. Today, David Gonzalez, our Director of the Victoria County Health Department, and myself will be discussing facial coverings, testing for COVID-19, and a general update of COVID-19 in Victoria County. As of right now, we do have one case of COVID-19 today, bringing our total case count to 115. Victoria's new Stay Safe, Reopen Responsibly order went into place at 12:01 a.m. this morning, which does allow for some businesses that were previously considered non-essential to open, as long as they enforce the social distancing requirements of 6 foot, increase cleaning of common and frequently touched surfaces, and now all employees who have contact with the public are required to wear a mask or facial covering. Now, we have heard some comments online, and I would like to point out that these facial coverings do not have to be a surgical mask or an N95 mask. You can actually make them very easy at home. They don't have to be sewn or anything. And this is, for example, what I made today coming in. You can do it out of just a piece of fabric, fold it into thirds, put rubber bands through either end, fold it in, and it works perfectly, and that's just to keep any of those respiratory droplets contained. And so I just wanted to point that out because we did get some questions to that. So they do not have to be a surgical grade mask or anything else. It can be a scarf you have at home, a bandana, or a homemade one. And so we are also recommending that the general public wear facial coverings as well. And so CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores or pharmacies. They also advise the use of simple face cloth coverings to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. So these face coverings should also not be placed on young children under the age of 2, on anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. These coverings should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to the shape. I'll now turn it over to David Gonzalez, our Public Health Director.
Thank you, Caitlin. Just to summarize a little bit and touch on some of the points that Caitlin mentioned, we do have one new case today. Brings our total to 115. We have the 2 expired individuals. 44 active cases right now. We have 69 recovered, 12 hospitalized, and only 2 in the ICU now. So we were able to move one patient out of the ICU recently. So that's encouraging news. Want to touch a little bit on obviously the outbreak situation just really quickly. Just a few numbers on the 2, both north and southeast of Pam. Total of the Pam North outbreak is 44 cases, and this was the initial outbreak that we reported a few weeks ago. 35 of those were actually Victoria County residents. And on the Pam Southeast outbreak, we have a total of 11 cases identified to that outbreak that are associated with that, and 7 of those are Victoria County residents. As mentioned yesterday in the press release, they are currently conducting a terminal cleaning of the facility. So we've had some questions on what exactly is terminal cleaning versus a regular cleaning, a standard cleaning. So terminal cleaning is defined as an intense disinfecting procedure that involves removing every detachable item in the room for disinfection and then properly disinfecting light fixtures, air ducts, and all surfaces from the ceiling down to the floor. So they're currently working those procedures to ensure there's no further spread in that facility at this time. A little background, the confirmed COVID-19 employees of that facility of the associated outbreak have been removed from that facility, and they are isolated at home, just a standard procedure with every case that we have. And those patients that were in that facility had been moved to the Pam North facility. So currently that's where the status is on those individuals. Just also want to point out there's been based on investigations, there's been no elevated threat identified to Citizens Medical Center at this time. So based on that facility and the issue there, the outbreak situation, there's been no elevated threat identified at this time to Citizens Medical Center. I want to move on really quickly to testing. Right now, as of this morning, the labs in the area have conducted 1,260 tests. Looking back at this past week, we're averaging about 25 tests a day. So it gives you an idea of kind of the demand on that testing, the test done locally here with physicians. Since reporting last Friday, it's a total of about 110, it looks like, going back. And think of that actually, the number may be a little bit different, to take us to about 25 a day. And currently, as of this morning, we had 23 pending tests at this time. I don't have an updated number for this afternoon. We'll get one in the morning. But as we mentioned before, we have one new case today from those. We have added a list of all facilities that are performing tests actually in the region, both Victoria County and surrounding counties. That's been posted on our website as well as our Facebook page. And you can go to that if you have any information or need for testing. If you don't have a physician that you use, a family doctor, then you can go to that list and look for available places to get tested. And we've had some questions regarding the accessibility and availability of testing for uninsured or underinsured individuals. And one thing I would encourage you to do, if you have some questions regarding that, if you seem to have difficulty paying for the test, you can go and call our hotline, and they should be able to help you and direct you to a clinic that's appropriate to help you out with that. Other than that, that's all I had for today. I will pass along to Caitlin for any questions.
Is there any location in Victoria available for citizens for free masks?
That's a good question.
Good question.
At this time, I'm not aware of that, but I can look up that information to see if we know of any maybe non-governmental entities or nonprofits giving out facial coverings. And again, I would just like to point out that they don't have to be the actual surgical mask. If you have an old t-shirt lying around the house, you can cut that up. There's actually some no-sew tutorials that actually show exactly what you need to cut out to make ear loops, and we'll be posting that on our Facebook page after this briefing.
Regarding the PAM Southeast outbreak, how did this happen? Do we know how this happened?
It's currently still under investigation, try to determine the initial factors that caused the outbreak. But yeah.
Any idea how it might have happened?
We're not releasing information right now. It's still under investigation. It takes a while. The initial push for information and I guess determination are really to identify those close contacts and identify those possible cases and those exposures. And that's really what we try to before we get come to a conclusion about the absolute reason it happened. We want to make sure those patients are initially identified and some of their close contacts. But we'll hopefully have some of these situations, outbreaks take longer than others to determine a final, cause of the outbreak.
What steps are being taken to ensure the other floors at Citizens Medical Center are protected and remaining operational?
Mm-hmm. Yeah, that's part of it. That's part of the process. We're trying to identify those close contacts and those high-risk contacts to isolate them, and especially with the positive cases, obviously removing them from the facility. Both facilities, obviously Citizens has been a great partner, have been very proactive on preventing that, as well as PAM Southeast, and making sure there's no further spread out of that facility.
Going based off what he said, is there any correlation between the PAM North and did people transfer it into the PAM Southeast location, or was there any correlation between those two?
We haven't identified anything at this time, but that's not to say later on down the line, as far as the investigations when they get deeper, that won't happen. But at this time, there hasn't been any correlation that we have found. Again, there's still investigations are ongoing though. Yes, sir.
I would love to know what are the details to an investigation? Can you describe what an investigation looks like?
Sure. So from epidemiological perspective, initially what they want to do is once they identify a positive case, they're going to interview that person extensively, basically going back. It's different, obviously, if they've been in public versus been a patient in a facility. In patient in a facility, you're looking at those exposures to healthcare workers that may come in and out and treat the patient. You're going to identify the amount of PPE and the level of PPE that those healthcare providers have worn in and out while in contact. So obviously, if you're a patient in a facility, you're not out in the public, so it's kind of restrictive. Now, however, on the other side, go ahead. Did you want to?
Even more to clarify for something like this, where we've identified that these two particular places have a high number of positives. So what goes into into the investigation such as this? Sure,
and it's similar to the other piece that I was getting into as far as the healthcare workers and just anybody generally in public. You're really focusing on what contacts they've had, who they've been around, where they've been. If there's, you're going to determine the risk factor and the risk level. If they've been around people for an extended period of time, And in this particular sense, in healthcare workers, again, it goes back to the personal protective equipment and at what level they're using. If they're using it, if they identified using it properly, the extended period of time they're with several patients, or even in congregate settings within the facility with other employees, you're really trying to determine those factors and the exposure levels there. And keep in mind, an outbreak, in a sense, in any facility, it's a fairly low threshold, 3. So if we have 3 exposures in one facility we can tie together, then we determine it's an outbreak. So that actually has a finite number that we look at and determine. And that's healthcare facility or any other location that we've had, and we can identify the originating that facility, and that's where that spread occurred.
So to restate, 3 is considered an outbreak?
Correct. 3 is considered an outbreak.
3
So,
positive.
yeah.
Oh, that's
Mhm.
interesting.
Yeah, it's a fairly low number depending on the situation. But I mean, it shows how we want to, when we identify that, we want to jump on that and take it very seriously, especially in a healthcare setting, obviously, so we can move forward and move a lot of resources and really try to get that tackled pretty quick.
Is there any indication yet that Pam made any mistakes or wasn't taking proper precautions in ensuring the safety of their patients and staff at either location?
Yeah, that goes back. We're still on our investigation to determine those causing factors.
And also, previously you said there was no elevated threat detected at CMC. How do we know that, and what exactly is an elevated threat?
Yeah, and that kind of goes back to the investigations. We haven't really determined that there was any high exposure risk outside of that floor going into the rest of citizens. And if there was any, I guess, workers or individuals going from citizens to Pam Southeast, they were using proper PPE from what we understood. So that's where there's no elevator risk. We can't come out and say definitively no risk, period, but based on initial investigations, we found no elevator risk.
Were the employees, were they tested previously during the first original outbreak? Were all PAM employees? Because, we're looking at 2 different facilities.
Right.
Is it under one corporation?
They are under one corporation, but I can't confirm or deny either if they're all of them are tested. Yeah. Yes, because I just don't have the list. I know there's initial testing on PAM North, their employees and patients. I can't confirm the PAM Southeast though. I could look into it though and see what kind of information we can get on that.
Have we handed down a similar order for the Southeast location like we did with the first location, ordering all staff and people there tested?
On the control orders you're speaking of, John?
Yes, sir.
Yep, not yet, not this time. We didn't identify the need. The control orders the last time were put in place because some of the ancillary services they offered at PAM North, which included wound care, and there was another one, this slipped on top of my mind, about another therapy. They had patients coming in and out on a regular basis during the day. They had a lot of outpatient services that were needed to be restricted and shut down, so there weren't further exposures that were happening there. And we didn't really see the need in this case to initially order or put a control order in at this time based on, I met and talked with Dr. McNeil yesterday, and he didn't advise that as well either.
What does an outbreak mean for the ability of our medical community to remain capable of handling COVID patients in the future? Like, how worried are we that our medical abilities might be hurt by outbreaks like this in the future if there's a 3rd or 4th outbreak?
Yeah, I guess it more so is we're going to have to look at it at a larger scale to see if it's an outbreak in a large facility affecting a whole facility. This one's pretty isolated in a floor in a sense in this case, and then with the PAM North, it was in one facility. Both the major hospitals here, we feel there's no threat at this time to their patient capacity and the patient care. They're doing great. They're no identified, again, elevator risk. So obviously in the future, if there are larger scale outbreaks, something we look at. But again, the part of the epidemiology team and public health in general is to really mitigate and stop those effects as soon as we can, so it doesn't affect the healthcare system as a whole. It's really isolated to one facility.
By the way, I'm piggybacking on that isolation. Would love to hear more of just what this Southeast facility looks like and how it is isolated.
Can't really get into details because I'm not real familiar with it. It's a relatively new facility, but from my understanding, it's one floor of a wing or 2 in Citizens. I don't want to speak too much on it because I'm not completely sure because I haven't set foot in that actually. But they operate as a separate facility, and that's really all as far as details go I want to get into just because I'm unsure.
Any idea, have we identified any non-patients or non-physicians, maybe like community members, lay people who have been infected with these outbreaks? I'm wondering if patients or physicians who were infected might have gone out in the community and might have infected other people while they're doing that?
No, I don't really have the information, that detailed information this time. I don't want to try to estimate or guess on that right now.
My last question is, now that we've reached that 7 to 10 day period for Easter, have we seen anything that looks like Easter affected us in any big way?
Yeah, so we're actually talking about this before we came in. We're kind of anticipating the question. It's a good question. We have some unidentifiable community transmission cases, but we have some, but not a huge portion. A lot of these are going to be contributed to the outbreak. Some of those outbreak numbers that were identified that we've been discussing go back to previous cases that have been reported that now we can associate to an outbreak. So you may see some of those numbers differ as far as new cases that come up identified in an outbreak may not be new cases that were identified in the community totals. So yeah, we did see some unidentifiable ones. Keep in mind the information that we get is only what we're given by the cases. So and they've been cooperative from what we understand. But yeah, we're definitely on right about the spike. Hopefully this is it though. Hopefully we don't see any further effects. So.
This question comes from a county resident. He was wondering about testing specifically. He and I have heard that testing is going to be vital to the reopening process nationally and locally. But he's wondering and worried that some groups of people, like elderly people or people who don't have a whole lot of money, that they might not seek out the test because there might be some obstacles, such as having to get a doctor's note. If you're older, you might not want to go to a clinic because it might be dangerous. If you don't have a whole lot of money, even a small fee might be too much to pay for that. Are we considering anything to make tests more available as we start to reopen?
Sure, and that's a discussion we've had as well as far as that access to tests for those that may be uninsured or underinsured. As far as the concerns about going to the clinic, the best thing I could tell you is to call ahead and discuss with that clinic if they don't have a healthcare provider, or even calling the hotline and get some information from them directly about accessing those services that are available to those folks. I think that's the best start. That's the best thing we can tell right now is to call the 580-5796 number, the hotline. They can get that information to try to seek out, one of the clinics or two that have providers that can get allow for access to care for those uninsured individuals. As far as the concerns regarding the safety and not wanting to go in a facility, I know the ones I've heard and what I've seen, they're doing great. The staff is masked at all times in those facilities, especially when they're doing patient care. And then we obviously strongly encourage the public going in to wear a mask as well, and that can offer that additional protection level for those folks. But I can assure you we do have testing available. Everything we've gotten across the county, we have plenty of tests available to those folks. Hopefully, I know in the beginning there were a lot of hurdles to testing, and I hope we figured out a lot of those hurdles. A lot of those were the initial requirements by the CDC to have certain guidelines met, and I know that they've relaxed that a lot. So now it's pretty much in the hands of the medical provider to allow those tests to happen and prescribe those.
Have we learned how our Victoria firefighter caught the virus?
Not at this time. Not at this time. That one's still under investigation. And part of the investigative process, we're not releasing that information because of protective health information.
Were you aware that a group of people were protesting at HEB in Victoria today about business closures? What would you say to them?
I wasn't sure exactly. I don't know if Caitlin wants to touch on this also. I wasn't sure exactly what we did hear about that one. I did see it actually on Crossroads today. I saw the live coverage on that. And from what I saw, they're socially distanced. Encourage that. So I think they're being safe and smart about it on that end, and they encourage free speech. I'm not sure exactly which side of the issue they're on, but can definitely encourage free speech and safe social distancing.
Can you tell us more about what kinds of vulnerable people were at the Southeast Center and above and below those floors in the medical center?
No, I don't have the information. No.
If there's no other questions at this time, I'll go ahead and close us out. Just to reiterate for some people that may not have caught it, we do have one new case in Victoria County, bringing that total to 115. Right now, we have 44 active cases, which is roughly 38% of our cases, and 69 recovered, which is roughly 60% of our cases. And so with that, I just want to remind you all that for accurate information, please visit the Victoria County Public Health Department Facebook page or our website, victoriatxoem.org. We'll also be posting some of those tutorials for how to make facial coverings. If you don't have access to a mask or anything that you think you may need, you don't need to have something super professional looking, but just a nice cloth facial covering to keep you and those around you protected. If you have any questions regarding testing, the facial coverings, the new orders, please call our COVID hotline at 361-580-5796. This briefing will be on Suddenlink tonight at 6 p.m. That's channels 15 or 115. Fox 19 will also replay this briefing at 10:35. Following the closing of this briefing, a recording will also be aired on Kix, Q92, Jack FM, and Club radio stations. If you have any unmet needs at this time, please call 211. And there is a 24/7 mental health hotline, which is 833-986-1919. Thank you all for your time, and we'll see you on Monday.